Hey everyone, Dr. Bodle here. Now, we all know that life can get pretty hectic and busy sometimes, and it can become even more of a challenge when we're dealing with a chronic condition like Hashimoto's. Often, people will wake up in the morning and wonder, what is today going to be like? Am I going to be able to go to work and do my job? Will I be able to complete all of my errands? How much stamina will I have before I totally crash and burn out? Not only are these legitimate concerns for our health, but it also makes it really hard to plan and accomplish the things that we want to. So, when I suggest to patients to add one more thing to all the things that we already have to do, it doesn't always feel like the best idea. But in today's video, I'm going to make the case for you why I think tracking our health can be so important, and also the best and most effective way to do it. That way, you can maximize the outcomes of your efforts. And remember, if you like this kind of content, don't forget to like and subscribe for more of the same. And if you're interested in working with me, hang with me till the end of the video so you can learn a little bit more about my online course, Natural Hashimoto's Transformation. So, as you know, and as we just alluded to, one of the big challenges with Hashimoto's is the variability in with which it presents. Not only the differences from person to person, but also how things can change for you as an individual over time. The reason for this is because there are a number of inputs that influences the way that our immune system works. If those inputs tend to be more supportive, then our immune system is going to function better. There's going to be less inflammation, more tolerance, and likely that will lead to improved thyroid function, which can help to support our symptoms. On the flip side, if those inputs are stressful to our immune system, then we could potentially have a flaring of our condition, and that can make us feel worse. And although it would be nice to just take a mental note of these things, in my experience, because autoimmunity is so complex and there's so many different variables, I find that if we do want to have better results and take control of our health, we need to be more intentional about the tracking methods that we use. If we track our health appropriately, we can do things like go back 2 weeks and look for any changes or trends that might indicate why we could be feeling more poorly. But in general, it provides us with a foundation and understanding of where we're at. Sometimes, because we are so busy, it can be really hard to understand what those inputs that we talked about look like. And if we don't have that perspective on where we're at with our health, then it can be really difficult to make changes moving forward. Now, sometimes I'll get pushback from people and they'll say, my diet is fairly consistent and so I know what it looks like on a regular basis. Or I'm really happy with my nutritional choices and I don't want to change it. And in these situations, I would just suggest two things. One, as we'll talk about, health tracking is not just about our food. Yes, that's an important component, but food is only one aspect and one influence over our immune system. And it's important for us to have a well rounded approach when it comes to our health tracking. That way, we can control as many of those variables as possible. But the other thing that I might point out is sure, you might be happy with your nutrition, but are you happy with your symptoms and your outcomes? Now, of course, I'm not saying that your current choices are bad, but by collecting a little bit more data, it simply allows us to know where we're at. We might be happy with our nutrition, but if our symptoms aren't responding the way that we want them to, then making a change from our current starting point might be the thing that we need. So if we are going to start doing a better job of tracking our health, what do we need and what should we be paying attention to? For my patients, I like to keep it as simple as possible. So the first thing that we want to do is acquire some sort of food tracking app. I often recommend things like Chronometer or MyFitnessPal, but it doesn't matter too much as long as it's something that's fairly easy for you to use and makes the most sense. The reason why this is important is because the app takes a few things off of our plate that would be a little bit difficult for us to do otherwise. Now, one of the big parts of tracking our food and meals for Hashimoto's is identifying potential food triggers that could be irritating our system. We want to look at things that we're eating on a regular basis and see if it's contributing to any of our symptoms. Now, of course, this could be accomplished by using the app or by even writing it down in a paper journal or using a notes app on our phone. But what the nutrition app also does is it'll give us a breakdown of nutrient intake and also macronutrient distribution. Essentially, how many vitamins and minerals are we getting from our diet? And also, how many calories and what types of macronutrients are contributing to the majority of those calories. So, yes, the types of foods that we're choosing and the frequency with which we're eating them can be done anywhere, but that additional data and information that can come from the app breaking down the foods that we're choosing can be another helpful metric from which we can make changes. This might mean looking at your breakdown and noticing that on days where a large percentage of your calories are coming from carbohydrates, you don't feel as good. Or maybe you notice that when you have higher fat meals, you're more prone to digestive distress. These sorts of things might not be apparent right away, but as you collect that data, the trends will become more obvious over time. However, without this data, some of these nuanced responses that your body is having might be impossible for you to remember and could be even more difficult to correlate it with some of the choices that you're making. The second thing that I think we do need is some sort of paper or digital journal that we can use to take notes. Yes, the app can give us a lot of information about our food, but the journal provides the context and also fills in a lot of other gaps for some of those other factors that can influence our immune system. In our journal, we want to include things like our water intake. Did we exercise or move, and how did our body respond? How long did we sleep, and what was the quality of that sleep? What were our stress levels on a particular day? Did we take our supplements and our medication? And most importantly, what did our symptoms look like? While this won't cover absolutely everything, it's a great place to start. And as you might have noticed, it includes a lot of the things that we have some direct control over. And so if we are looking to make changes, this is a fertile area to begin doing so. Now, in addition to all of those main metrics, I also like my people to add two more categories. One of which is the anything out of the ordinary category, which is essentially, did something pop up that is really different and isn't something that you commonly see in your life, but could have an impact on your health? And that could be anything from a really busy day to having to take antibiotics for a dental procedure. Again, things that are different, things that are out of the norm. You might find that by tracking things that are outside of the ordinary, when you go back and look at health changes, whether better or worse, sometimes these things can correlate quite tightly. And finally, the last category is positive changes or improvements. As we all know, chronic health conditions are tough. And even when we're getting better, there's still going to be days that are up and days that are down. In spite of all that variability, I like us to be able to take a moment to focus on the good things. Of course, this could be something that's health related. Maybe your energy was better for 3 days in a row, but it could also be celebrating a choice that you made. Maybe you've been struggling to get enough sleep during the work week, and this last week you made a concerted effort to go to sleep 30 minutes earlier every day. Or maybe you've been having a tough time saying no to sweets, and when a friend offered you a donut, you decided to pass in this particular situation. Just like our health symptoms, some of these things can be easy for us to forget. And because our attitude is such an important part of helping us to be successful in the long term, having a little bit of that positive reinforcement on a regular basis can go a long ways. And finally, some people ask me if they need to do health tracking for forever. And the answer is no. Just like anything else, health tracking is a tool. In my opinion, a very valuable one, but we need to use it when it's appropriate. If you're someone who feels totally overwhelmed by doing this, then don't do it. But my recommendation would be to use your health tracking for a few months, establish where you are, identify some of your trends, get a better understanding of your health, and then once your improvements and changes are more consistent, you likely don't need to be as diligent with your tracking. Of course, as life changes, or maybe you get a little off track with your health, you can always reinstitute that tracking, at least for a period of time. So find what fits and feels best to you, and don't get too stressed with some of the details. But no matter what our health challenge is, knowledge is power. It allows us to better understand our condition, understand what treats our body right, and facilitate the changes and choices that we need to make to maximize our outcomes. So if you haven't been tracking your health, or maybe you haven't been too diligent about it, I would highly encourage implementing this strategy and using some of the points that we discussed today. I think it'll make a big difference for you. But of course, let me know what your thoughts are. Let me know if tracking is something that you like to do, or if there's something that you took from today's video that you're going to implement as part of your strategy. If you enjoyed today's information but need more help and you're interested in working with me, then I'd recommend sending an email to contact@seattlethyroidhelp.com. That way we can get you more information about my online course, Natural Hashimoto's Transformation. In the course, I work with women who have Hashimoto's who are frustrated and exhausted, aren't getting any help from their doctor, and are overwhelmed by trying to do things on their own. I'll help you to understand your Hashimoto's and health better than you ever have before, while also providing a blueprint and action plan around natural strategies like nutrition, lifestyle changes, and supplementation so you can get your energy back, improve your symptoms overall, and start feeling like yourself again. The course includes 8 modules that are packed with information, weekly live question and answer sessions so I can support you every step of the way, and a supportive and collaborative Facebook group. So if that's something that sounds like it might be a good fit for you, make sure to reach out so we can find a time to chat and go over all of the details. If you want to keep learning on your own, then I'd recommend checking out some of the other videos here on my YouTube channel, following me on Instagram or Facebook, or grabbing either one of my free downloads, which are linked in the description box below. That's it for this one. Thanks so much for watching. I love you guys and keep making great changes. If you did like the video, give it a thumbs up. If you're enjoying the content, subscribe to the channel, and don't forget to click on the bell so you're notified when I post a new video every Thursday. But my name is Dr. Bodle. I hope you have a great rest of your week, and I will see you in the next one.